Osteosarcoma is a type of malignant bone cancer. It affects osteoblast cells, which are the cells that help build bone, which affect bone growth. It is the most common childhood cancer. It can occur in any bone, but it usually occurs at the metaphysis of long bones. The distal femur is the most common location, with the proximal tibia and the proximal humerus next. It can affect adults and children. In children, it usually occurs during growth spurts. The peak is during ages 13 to 16 years old. Men are slightly more at risk than women, and African Americans and other races are slightly more at risk. In adults, men are more at risk, and Caucasians are also more at risk. With adults, it usually occurs around 40 years of age or older, but the peak is around 65 years old. The exact causes of osteosarcoma remains unknown. One theory is prior exposure to radiation. It can also be secondary cancer to another disease. A prime example is Paget's disease. Patients who have Paget's disease can develop osteosarcoma later on. This especially is true with adults and usually occurs around 65 years old or older. Another theory has to do with genetics. Patients who have certain mutations, including retinoblastoma and Li-Fraumeni syndrome, or defects in certain genes, can develop osteosarcoma later on. They have a higher chance than other people. Some symptoms of osteosarcoma include pain for several weeks to months and limited mobility in that joint. There can be swelling and soft tissue mass, especially if the tumor has been growing for a very long time. If the tumor is located in the lower extremity, patients could be limping because of the limited mobility. Osteosarcoma can spread or metastasize to other areas, with the lungs being the most common. The first step of diagnosing a patient with osteosarcoma is an X-ray. And here you can see on the left, right here, is an AP femur X-ray. You can see where the arrow is pointing. You can see the sunburst appearance, which shows new bone formation. And on the lateral femur X-ray, it shows right up here the Codman triangle, which is just showing the extension of the tumor. MRIs are very helpful in further diagnosing osteosarcoma. It shows great detail of soft tissue, and it's very helpful to show if there's skip lesions or metastasis in the bone. And here, this is an MRI of the tibia. The white arrow shows the extension of the tumor, and the black arrow right here shows the soft tissue mass. CT can also be used for those same reasons, but MRI has shows better detail. CT is especially important with diagnosing metastases, especially of the chest and lungs, since that is the most common spot. A PET scan should also be used of the entire body to see if it metastasized anywhere else. Treatment for it includes chemotherapy and surgery. Usually chemotherapy is used before surgery to reduce the size of the tumor and the spread, and it's after surgery used to reduce the chance of occurrence. For surgery, there's two types, either limb salvage or amputation. Limb salvage is the most common today and is the preferred method. With limb salvage, the doctor goes in and tries to remove the tumor and while keeping most of the bone intact. The prognosis today is much better than it was in the past because of the use of chemotherapy. The 5-year survival rate is 60 to 80% if the tumor is localized, 40% if the areas to where it was spread was able to be completely removed through surgery or it was only spread to the lungs, and a 15 to 30% chance if it has spread to other areas. Of course, patients with osteosarcoma, after treatment and stuff, will have to be monitored and the first 2 years after treatment, they have to be seen every 3 months. This includes all the imaging like X-ray and MRI and PET scan that they did before to make sure that there is no recurrence. 3 years after treatment, it's every 4 months. Years 4 and 5, it's every 6 months, and then after 5 years, it's yearly to go in for all these imaging. And then here is my references. That's it.